Okay.
Good evening and welcome to you all. On behalf of Sexual Medicine Committee Foxy, I welcome you all in the seventh episode of our psychosexual health series. My dear friends, we are again here with our esteemed faculty for today, Dr. TSS Rao sir, with a really an eye-opener for all of us. So before I would like to start the program, I would like to invite my co-moderator Sama Sultana to introduce the person behind all this program, our own chairperson, Neeraj Jadhav sir. Over to you, Dr. Sama.
Thank you. Thank you. Good evening, everyone. Now I would like to welcome and invite our leader and as Sir said, man behind sexual health programs overall India through Foxy, none other than Dr. Neeraj Foxy and past Vice President Rajkot Menopause Society. I would like to welcome him for introduction about today's session. Thank you, sir, and welcome.
Thank you. Thank you. So, good evening and welcome to this seventh session of the masterclass series on the psychosexual series by the Sexual Medicine Committee. First of all, I would like to share one good news from us. We have won the Best Committee Award from the Foxy for the year 2023. So, thank you everyone for your blessings and the good wishes. With that, only we are able to win this Best Committee Award for this year. So thank you everyone. And this is our seventh session of the masterclass series. Earlier we have done communication, then we did CBT, then we did censored focus therapy, then we did sex therapy, then mindfulness technique, and the last session was on the sex and gender. Today we are going to learn about the hypersexuality, sexual addiction disorder. There is always confusion about these two terms, high libido and hypersexuality. Libido isn't quantifiable on one size fits for all scale. Everybody has their own standard of libido. If sex drive drops from that standard, one is experiencing low libido, and if sex drive increase from that standard, one is experiencing high libido. If sex drive start interfering with the quality of life, then only it is a problem. A high sex drive is an increase in the sexual desire. On the other hand, hypersexuality involves out of the control feelings and the urge to have sex as well as a high frequency sexual behavior. In our webinar, we always get queries about how to manage high sex drive. So let's clear our confusion about this topic, that is high sexual drive or hypersexuality, because there is so much confusion between these two terminology. So we have a very renowned expert with us, Dr. Rao sir, will help us to solve all our confusion about this issue. And I'm thankful to our chief guest, Dr. Suchitra Pandit Madam, our guest of honor, Dr. Nirja Batla Madam, and Dr. Basa Mukherjee sir for joining and blessing us for this webinar. So once again, I welcome everyone and have a happy learning. So thank you. Over to you, Apurva. Apurva, you are muted.
Yeah, thank you so much, sir, for always being there and for always your great initiative which you have taken for the and really, sir, congratulations to you for guiding us so that we are the best committee for the year in the Foxy. So thank you so much, sir. So as we know in our culture, we always start some good thing from blessings of our senior. Special guest, chief guest, and guest of honor for today. And for chief guest, we have Dr. Suchitra Pandit, Madam. Madam doesn't need any introduction. She is a great academician, encyclopedia in herself. She is the past president, Foxy, past president, AICC, RCOG, past president, ISOPAB, past president, Gestosis India chapter, past president, the Mumbai Society what not. It's really our fortune to have you as a chief guest, ma'am. Over to you, ma'am, for your kind words and your blessings. Suchitra, ma'am.
Thank you very much, Apurva. First of all, as I said, it's a great honor to be here, invited as a chief guest by Neeraj. And Neeraj, hearty congratulations to you and your team for winning, the Foxy Best Committee Award. And I'd like to say that, psychosexual health is so important. And many a times people try to underestimate the importance. But a person has got satisfaction with his 5 psychosexual stages, that is the oral, anal, phallic, latent, and genital. The erogenous around zones, which is surrounded with these particular areas, if they are satisfied at an early stage, there is no deprivation, there is a satisfaction in the mind, and then that does not lead to fixation, and that makes a person psychosexually healthy. And sometimes we tend to underestimate these particular values. So very good session of this particular problem. And as you have already said, Dr. Rao is there, an expert who will be talking about hypersexuality. And many a times you see people like this in your practice and you don't know what exactly to do. So I'm very, very glad that you have Dr. Rao as an expert. And again, we are happy, all of us, we are a Foxy family. So happy that we have Rishikesh and Madhuri at the helm of affairs currently, and they have given, it's basically the Foxy, the committees. So 29 committees who form the big federation. And Apurva, I know you're going to take over from Neeraj in the month of January, but I hope that you also work very hard and put in your best possible efforts. Thank you very much for being there. And it's happy to be there with the co-chairs like Dr. Nirja Bhatla and Dr. Basav. So happy to be a part of this particular program. Thank you very much.
Thank you, madam.
Thank you. And I always need your blessings and your guidance. And definitely, I would like to continue the work which Neeraj sir is doing with all of your blessings. And Neeraj sir, I always need your advice and blessings, sir.
Always there
So
for you.
thank you so much, ma'am, for your kind words, for your blessings. So over to Shama for introducing our guest of honor. Yeah.
Yes, I would like to introduce and welcome our guest of honor, Dr. Basam Mukherjee, 2022-23 and FICO Regional Coordinator, Safer Portion and Secretary, IRC India East. Please welcome, sir, and thank you for joining us, and please bless us with your kind words. Basam Mukherjee, sir.
Basab sir? Yeah, Basab sir, you have to unmute yourself. Basab sir?
Yeah, yes.
Hi, hello. Sorry. Hi. Yeah, that's why I was just taking my time. Wonderful. I think I have to echo a lot of words which Dr. Suchitra just now told you. First of all, we don't know when the last time the Sexual Health Committee got the best committee prize. I don't think it's ever happened before. So congratulations, Neeraj, on doing something which is remarkable for in a lot of ways. Just one point I think I wanted to mention is that the nice webinars and the teaching that you've done in the Foxians over the years should have some measurable outcome about how much Foxians have learned about this art from over the last 3 years, because so much of effort you've done for the webinars, so many people have attended. I'm sure that their knowledge on sexuality or dealing with sexual problems in women and men would have increased. So some sort of a measurability or some sort of people would definitely, we would like to see that people have changed. There's some positive outcome about all the work that you've done in the last 3 years. Also, we've seen your 2 lieutenants at all points of time. So whenever you have your CMEs, there are 2 lieutenants on both sides who are supporting you, guiding you, getting through the best faculty and making sure that these things are there. And most important, all your recordings which you have kept for the webinars, which are there in the Foxy archives. So I think you need to reiterate that fact that anytime any people want to go back, they missed something or want to learn something, it's all out there. So that's a wonderful work that you have done, because it will remain there forever. So in the next 2 years, so that people can always know where we started from. So wonderful work. And as Dr. Suchitra said, today's topic, again, so much of things we learn in gynecology, we don't learn sexology or psychosexual health matters. Some of us assume that we know a lot of it, but when we talk to patients, we stutter, we fumble, sometimes we feel embarrassed ourselves to ask the correct questions, and sometimes the patients also, we can't get them at ease. So I think there are a lot of your clinical practice. I'm sure Dr. Rao, over his discourse, would be touching on some points of that, and that will be extremely useful to all the listeners and viewers. Congratulations on your good work again, and keep up the good work, and let the flag of the Sexual Health Medicine Committee be carried on and go high with every time. Thank you very much for having me here. It's a pleasure always. Thank you, Shama. Thank you.
Thank you, sir.
Thank you so much, sir. Rishikesh Pai sir is there. Neeraj
Yes.
sir, thank you so much, sir, for coming us for blessings, and in your busy schedules you are coming. It's really our fortune to have you.
Thank you, Apurva. Thank you, Neeraj. Congratulations for your award of the best committee. And I can see Dr. Suchitra Pandit, our chief guest, Dr. Rao, who is going to be the speaker, Dr. Basab, our vice president of the last year, Dr. Nija Batla, the vice president of the next year, and Dr. And then, of course, Apurva, who is going to be the chair of the committee, is going to take over from Neeraj. And so, when I did my MBBS and I did my MD, I was a bit confused as to what to take, because no one thought that I'll, like my father was a professor of public health. They thought that I'll, diversify and go into public health. And at that point in time, I wanted to take up sexual medicine, because that time Masters and Johnson was very hot. I remember. And my dad actually taught Prakash Kotari. My father was the original sexologist type of thing, but he was more in the family planning area and sexology. So whenever I meet Prakash Kotari, he says, your dad was my mentor and he taught me everything about sexual medicine, because he used to be my father's assistant in family planning department. After that, he of course branched out and went abroad, learned sexology, and he started the Department of Sexual Medicine in KM Hospital and GS Medical College, which was my alma. Obviously, you know that he's a very famous. We had recently called him also. So every time I talk to him, he talks about my dad. So, I feel very pleasurable about it, because my dad was a, great guy, fantastic orator. Like what I am, he was 100 times at a higher level than what I was in oratory. And people used to look up to him. He was a, family planning director, got Padma Shri at a very young age. 44 years he got Padma Shri. The ministers at the center used to love him. He was a great level. And I always say that now we need to be more implementation oriented. Those days, they are very implementation oriented. Then slowly, research crept in. And now, we have this style of, identifying a district, then trying it out, then expanding it. I don't believe in that philosophy. I'm a Dr. Pai, my father's philosophy of utilizing and doing extensive implementation and rapidly, So that has to be done. Nowadays people are very tentative, I feel. Of course, it is going on system of implementation, testing it and then expanding it. And the same system can be applied to sexual medicine also. But I feel sexual medicine is one area where the digital interface can be more, it's very awkward. Even for me to go to a chemist and ask for a condom is not that easy, So it's a awkward field of life. People are not very open to express themselves on this. So I feel that we can use, and that's what I told Neeraj also, that we need to go wanted to create this digital interface, but I can't. How much things you can do in 1 year? Na? So maybe Nirja Batla, Dr. Jaybir Tang and their team can do it. So create a digital interface to train. So people anywhere of various levels can just access the net, go to the area, write that whether they are less than 18 or more than 18. And if they are less than 18, they can click less than 18 and we can have a module to teach them. And more than 18, we can have a module to teach them about everything about sex. So human being and asking him or getting that can be knocked off. Of course, if you're in severe extreme problem, then you need people like Dr. Rao to treat you. But I'm talking about the overall general, that awkwardness that is there whenever sex is involved in the conversation. So anyway, thank you very much for calling me here. And this is my fourth seminar, but I think after 2 months more, I'm always, in Punjabi, it's called that Vela. Vela means you don't have anything to do. So whenever Dr. Tang doesn't have time, he can always call on me and I can always, do his locum, so to say. So thank you very much for calling me here and looking forward to meeting you all in Paris, whoever you are coming now. We are all in the Paris meeting now and looking forward to that. Thank you very much, Neeraj, and all the best for your next venture. Now
Yes.
you'll be finishing your chairmanship. Don't forget sexual medicine. Support Apurva in his future. And of course, you need all the best.
Thank you. Thank you, sir.
Thank you.
Thank you so
Thank you
much,
so
sir.
much, sir, for coming and for your blessings. So,
I would like to welcome and introduce our Vice President Foxy, Dr. Asha Bakshi ma'am. Please give your blessings to our today's session, ma'am.
I think Apurva, I think Neeraj is my favorite. And he has been doing such good work and always very enthusiastic. And even for my vice president conference in the Facebook and also thanks Neeraj. Doing very good work in sexual medicine, lots of awareness, and I'm proud of him that his committee got as the best prize award. Another thing is during this managing committee, he could his leaflets on sexual medicines were released. And, these leaflets are really, really very helpful, very informative, and I would recommend all the Foxy members to have a copy of these leaflets and they print it out and put your name also and keep it in your reception, and it would be a real helpful to the society because sexual problems are such that people don't want to talk, but if they see these leaflets and they are sitting in the OPD and they go through these leaflets, then they know that yes, that there is treatment, there is help for these problems and they can be solved. So that is a very good thing. And again, I would like to congratulate Apurva for his elections and at the same for that also, and keep doing good work. And the whole team, Shama and Dr. Kamble, all are doing very good. And thanks, Dr. Rao. You have been all the time there while writing the leaflets in the book and for all the webinars. And thanks a lot for doing so much work and for coordinating with us. So thank you very much. And so nice to see Dr. Suchitra Pandit here, who is there. She's a very good friend and always she'll have some I'm going to listen, hear all those things from her. So that is a good thing. Then Nija is doing very good work in oncology and preventive oncology, which is the need of an hour. And I'm thankful to Dr. Pai to give us so much freedom and happiness and enthusiasm so that we can work freely during our tenure. So it has been really nice. And now slowly we are going towards the end and we are feeling about having the feel that yes, now we have to so thank you very much, and it has been nice being with you all. Thanks.
Thank you, ma'am. Thank you so much. I would like to ask Dr. Apurva sir to introduce and welcome Dr. Nija Batla ma'am, our guest of honor.
Yeah. Thank you so much, Sama. Thank you so much, Asha ma'am, for always being us, for always your kind words and for always your blessings. So we have our next guest of honor, very dear senior of mine, Dr. Nirja Batla ma'am. She doesn't need any introduction. Ma'am is the best AIMS Delhi. Ma'am is the is the professor of the Sobha Wager Distinguished Professor of the Gynae Oncology. Ma'am is the Vice President-elect of 2024. Ma'am is the Council member of the Asian Society of Gynae Oncology, member of the WHO DG Technical Expert Group on the cancer cervical elimination. Ma'am is the past chairperson of the FIGO and the FOXY Gynae Oncology Committee. Ma'am is the Secretary General of IFCPC society and whatnot. Thank you so much, ma'am, for accepting our invitation and coming here. Over to you, ma'am, for your kind words and for your blessings. Nirja, ma'am.
Thank you so much, Dr. Apurva. Such a generous introduction. That's very kind of you. Thank you very much at the outset to Dr. Neeraj Jadhav. He has been so persuasive and kind. When I said to him, no, we are hosting today, you know, we had all day from 8 a.m. onwards the workshop with Dr. Arul Kumar and Professor Tim Draycott for the RCOG conference, you know, for PPH and CTG. So we had it in our skill lab at AIMS and it was a very busy day. But he said, no, it's okay. I'm sure you can come out for 5 minutes. And he's so gentle, so persuasive. There was no way I was going to say no to him, really, really. And I'm so happy to be here with all of you, with all the illustrious dignities, and to meet Apurva after his election. I think I'm meeting him first time in a webinar today. The one to meet all of you. I think a lot has been said about this, and I think we have to really applaud the way Foxy has built up, the way our predecessors have built it, to have so many committees that look at every single aspect, far more committees than FIGO has or anybody at all. And this is so important because we have such a large organization, so many members, that even with so much workforce on the ground, with 29 committee chairpersons literally spinning, it's really creditable that we can focus on each aspect. And truly, as has been said, this is an aspect which even WHO has emphasized the need to train all physicians to be able to deal with issues of sexuality with patients, because as we have discussed that it is an embarrassing issue. Sometimes our physicians don't want to talk about it. Doctors don't want to talk about it. They don't know what to do, or they are feeling embarrassed themselves. So they are in turn making the patient more embarrassed. So actually, we should train physicians to be able to deal with sexuality in a way that is non-committal, in a way that is non-judgmental and very unbiased, so that the patient is comfortable and able to deal with it. And in many cases, this makes a critical difference in quality of life of patient. These are issues which are not life-threatening, so they may not be something which get measured by any barometer, but they change completely the quality of life, the quality of relationships, and therefore they are of immense importance beyond member of the society. So I am really looking forward to the lecture by Dr. Rao, and I'm hoping that we will all learn something from it. And I'm so happy to know that all the lectures are on the Foxy website, because there are a lot of people who cannot attend it will surely benefit from the archive. So Apurva's got a tough thing coming. Yeah. There's a very, very high standard set now. Absolutely. Congratulations for being and to live up to that and to rise. Fortunate in the system in Foxy that we have time to prepare and set the bar and really hit the ground running, as they say, so that right from day one you have your plan chalked out, that this is what we have done, and build upon what has been done, sustain that what was good, add something new. And that is another thing. We are very fortunate as doctors that there is so much that is ever changing. There's no scope of burnout, because there's no scope of getting bored. There's always something new, something to add to. And he's another person we're very fortunate to have. Now, maze mein, I don't know what all he can do and give suggestions so casually, which you will think about and you will find a way to implement them. So we are really fortunate to have that person. But yes, I agree with him. Implementation is what it is all about now. In fact, even ICMR Director General presently is very focused on implementation. He says we've done a lot of research, but how is it translating in practice? So it is excuse me, a litigious society. Do is backed by data, otherwise patients will already they get up in arms. But we have to also make sure that we are doing research that is meaningful, that is going to help people, and that there is going to have some, path changing, practice changing, actually thing. So it's nice to have talks like this, which are really going to influence us and which are going to help us in our day-to-day dealings in this thing. So without further any delay, I think we all want to jump into now hearing the
Thank you.
Thank you, sir.
Thank you so much, ma'am, for your kind words and for your blessings. And really, ma'am, I always need your guidance because I start the tenure in the month of January. So I definitely, I always need your to you, Dr. Sharma, to invite our TCS Rao sir and to start the scientific program.
Yes, now very much awaited after 6 episodes of psychosexual. For this, I would like to introduce Dr. T.S. Satyanarayana Rao sir. He's a professor, Department of Psychiatry, and immediate past General Secretary of Indian Psychiatric Society. He has a number of publications and awards. To take over session on hypersexuality. Over to you, sir. Rao sir, you can
Yes, sir.
start the session, sir. We are waiting.
You're able to see?
No, sir.
Please share the screen, sir. Share the screen.
I shared it. What happened? From there it disappeared actually. Okay. I think for a while.
Above the screen.
Okay. Everything was all right. Okay. You are able to see?
No,
No,
sir.
sir.
No.
Select screen with PPT, sir.
Okay, 1 minute. Share screen. Oh, that.
No, sir.
Yes, sir. Now
Okay.
it is there.
Sir, this is not PPT screen. Another screen you share.
Sir, you have to go back and to your screen. Uh,
Yes,
yes,
sir.
sir. Yeah. Yes, sir.
Okay. Now?
Yes, sir.
Yes,
Absolutely,
sir.
sir.
At the outset, let me thank Foxy for the wonderful opportunity you people have provided. Speaker is called, and after a session or two, people get bored. This is the 6th session of mine, and still you would like to listen to me. Means I'm really grateful both to the God, family, and you people for this wonderful opportunity what you are providing. Being a little selfish, I was wondering whether I can spare this amount of time, but then I'm contesting for the president's post of national body, and all of you, please tell your psychiatry fellows, friends that Rao is there contesting. Of course, this is one important. This presentation is on hypersexuality, which is usually not spoken. People use sometimes the word sexual addiction disorder. What it actually means and where we actually really stand as far as this concept is concerned, the extensive controversies surrounding this particular topic, and terms. In fact, there's a whole lot of confusion. See, if you try to look at the American system, they have totally knocked off this particular disorder, whereas the WHO system has placed another different terminology, which I will come in. If I was speaking to a psychiatrist, I would have spoken it totally in a different fashion. But keeping in mind that I'm speaking to the gynecologist, and there are a lot of concepts in psychiatry, if I try to elaborate too much, it will add represent. So I have tried to simplify. On and off, I may be digressing a little bit, actually to bring to the focus, when actually to label something as hyper or addiction. So this is where actually we really get stuck. Second point is extremely common in psychiatric practice, more particularly when we are dealing with certain type of disorders. In certain disorders, it gets affected in so many ways. It may be less or more. That is actually what we talk about, inadequacies or dysfunctions too. In fact, the range of things, what we talk about gender identity.
Slides are not moving.
No, slide not necessary to move. I'm just talking and then I'll move. So the idea is actually that certain disorders will have certain specific problems. Certain disorders will present along with paraphilias. And when we are using the word addiction into the picture, what I am trying to what's that? Okay. So to start my presentation, what Charles Darwin, the father of theory of evolution, what mentioned, we do not even in the least know the final outcome of sexuality. The whole subject is hidden in the darkness. Few topics evoke so much of anxiety and pleasure, pain and hope, discussion and silence as the erotic possibilities of our bodies. And this is one of the very embarrassing too. In fact, something hidden, people don't speak about, and we somehow do common problem. When we try to talk about a word like addiction disorders, the important point is we almost always get carried away by something called drugs. It could be alcohol, it could be narcotics, it could be stimulants, it could be other psychotonic drugs. Of course, the whole issue revolves around that particular point. A time was there when I was actually postgraduate student, people telling that we should not use the word. There is a lot of what we call as value-laden and other such aspects. And it actually brings into focus too many things which are actually not necessary to be discussed. But things have changed. Now, say for example, at All India Institute of Medical Sciences, National Institute of Medical Sciences, and other institutions where PG programs have started, there is actually DM in addiction medicine. That means the term has come back again. So what we actually mean by that particular few sentences, what it actually mean by that. For all practical purposes, we try to avoid the word drug for the simple reason that when you are trying to talk about addictions, what people are using, they are not necessarily the ones which actually carry that particular purpose. No therapeutics involved. Now, these are all grouped under what we call as substance use disorders. Why I'm telling this thing? Because these concepts are applicable to certain behavior addictions, which we are going to talk about it 1 or 2 minutes later. Your particular substance is having a therapeutic purpose, and for that, you are using paracetamol to control headache. You are using paracetamol tablet to control fever. That is actually what we basically call use. When you use the term abuse, any substance used for a purpose other than therapeutics. It may be pleasure or it may be anything else for that matter. In fact, that particular concept, abuse, gets into the picture. Addiction is actually a little bigger concept which encompasses a lot of other related things. Old terminology carried little negative connotation that there is a person here using it for purposes other than actually therapeutics, and he is actually having some problems. This is having problems was one of the important inner concept associated with that word addiction. Dependence is one of the most recent terminology in all international classifications. What it actually they mean is that a substance actually produces the mind, and the individual finds it difficult to stay without it. And by chance he stops it or doesn't supply, he will get into a particular phase called as withdrawal and all the other related problems. So this is actually one of the concepts that has come into play. Tolerance is another terminology extremely commonly used, and when you are going to use it as a sexual terminology, you remember tolerance, there are two concepts. One is, if somebody is using some same type of effect in due course, indicates that there is actually something is actually body has got used to. In the same fashion, to get the same effect, individual has to either increase the quality or quantity of the substance. That way he will get the required effect. So these are all few of the important points that were actually there. And to cut short this particular little digression, addiction, psychological, physiological, metabolic for a drug, but now this particular concept has become a little bigger. What I was trying to talk about use and misuse, but people have, technically speaking, non-use to beneficial use to lower risk, higher risk, and ultimately leading to what we basically call addiction, where an individual is dependent on it, and without it, he will end up with a whole lot of difficulties. A person may move from one to the other phase. This is one of the very well established concepts. Range of what we call, take an example, alcohol, episodic or binge drinking pattern, wherein the individual would be totally free from for a certain length of time and then suddenly gets into what we basically call significant dependence. So there is something called that addiction. It may have leading to what we basically call the substance use disorders, starting from dependence to intoxication. Say, if you try to take an example like alcohol, there are actually 20 sub-syndromes which are called as the neuropsychiatric syndromes related to alcohol. But many of the time when you are trying to talk about the social reasons, the individual uses it as risky and lands up himself with a range of disorders. One of the classical examples is actually the HIV and such other type of disorders one may actually get into. So when we are trying to talk about addiction, there are two levels of discussion what we definitely need to make. One is actually the simplest level happening. Two, when we are using that word addiction, the range of social, cultural, and demographic aspects get into the picture. This fellow is not like any other illness. Somebody is having typhoid fever, treating him actually can be good enough. Maybe a little bit of water and other related areas where we need to talk about hygiene and related aspects. But alcoholic, he will create family problems. In fact, for all practical purposes, alcohol creates social problems, he creates forensic legal problems, he creates traffic problem, you name, economic. In fact, the list can go on. The range of people gets affected because of him is actually something. And the same concept as an analogy, we can reflect onto a lot of other dependencies which have come into being. And I was editor for Indian Journal of Psychiatry. We published this. In fact, this was edited by Chandigarh, and we had kept it in our Journal of Indian Journal of Psychiatry as one of the additional attachment, and this is available very comfortably in archival section. It is an open access journal, anybody can get into. Certain behavioral disorders were actually extremely commonly reported at that particular time. I still remember one of the editorial we carried was digital boom spelling cerebral doom. The technology actually benefiting in some bit of difficulty. We are losing our capacity to think, losing our capacity to do. In fact, we are deteriorating much faster than what actually necessary to be. So these are all few of the things actually which were documented earlier. So a new concept that came up subsequently is actually they are called as behavioral addictions. Just like drugs and chemicals can produce problems, there are a whole range of behaviors which can actually create quite a bit of difficulty for individuals. Elaborate each of these type of things in a very brief fashion and then get into what we basically call the sexuality. Food consumption. We are all well aware there are some people when they are put into any anxiety situation, binge eating is one of the extremely commonly reported problem, which I'll be talking to you 1 or 2 minutes later. There are a lot of ladies shopping and spending, compulsive buying, compulsive shopping. These are all actually people have documented. They can't just survive almost like that. Exercise. There are some people, in fact, we all say that exercise is one of the extremely important aspect of life. But there are some people involved in this particular activity to an extent that it can create quite a bit of difficulties too. Work and occupational activities, work addiction. Majority of we doctors are workaholics, work addicts. In fact, we don't take time, we don't much spend time with the family and a lot of other such things. And many of our partner may feel a lot of pain. Tanning, gambling, internet. In fact, this particular list goes on actually in a very big way in that particular fashion. There is something called as love addiction. This has to be differentiated from sexual addiction for the simple reason that here, of course, there is one specific syndrome called as D. Clerambault's syndrome. You must have heard of this particular thing. Udovsky and other related names are also there for this, referred to as erotomania. A psychological, in fact, a delusional disorder in which the affected people believe that a famous person is in love with them. I still remember when I was doing my postgraduate studies in CMC Vellore, some of the ladies so much in love with MGR, and it was something extraordinary to believe. In one given year, we had almost about 6 cases which were actually in this particular fashion. People, in fact, you might have come across wherein allegations are made against a minister. He's in love with me because this individual is suffering from, till actually it is documented properly, the person in a higher position can land up with a whole lot of difficulties and problems. Stalking and lot many other things for film actresses, actors and all, actually people have documented. They're all maybe related to this. It may be a simple behavior or it may be a complicated one, what we are actually referring to as delusional. One should keep it in mind. There is something, sexual pursuits, sex addiction. There, maybe the next few minutes, we'll be trying to decipher the meaning and the whole issues related to this particular aspect. When to call something as normal, when to call something as addiction, when to call something as part of some other major disorder, we have to actually try to look into. Recently, I had a case from Indore, referred by one of the psychiatrists, because he had almost all nearly about 4 people, and his whole idea is immediately, I should have sex with 100 beautiful girls. I should have sex with anybody, everybody. In fact, this is the particular idea. Very strongly insisting on this. In fact, not able to commit. Currently, he is having at least one very strongly associated girlfriend too. There are other 3 to 4 people who are there. With each one of them, he is not able to perform. And when we went into greater detail, and now currently he's there in our hospital, we are treating him with ECTs for. And there is a particular type of syndrome called as pseudoneurotic schizophrenia, or the technically speaking, we talk about simple schizophrenia or schizotypal disorder in the current classification, wherein schizophrenic symptoms will not be there. But these people are not able to settle on anywhere, certain odd these things, and they are characterized by pan-neurosis, pan-anxiety, pan-sexuality. Whole range of things actually they may actually present. These are all abnormalities. How actually one can look into and get into something as a behavioral addiction. There are some things called as behavioral excesses. Just like we have about 5 fingers. One is short, one is big, one is long. Behaviors also. Somebody is very much interested in sex. Somebody is very much least interested in sex. In between, we have a whole lot of this. Inverted Gaussian universal curve, what we talk about. In fact, this is one of the easily applicable this thing. There are some people on the extreme side should not be called as behavioral addictions. Many frequently preoccupied with sexual thoughts and fantasies. What has been actually said that men almost about 10 to 20% of the time in a given day, they will be thinking about sex. This is what actually. For one, actually maybe a little less. So it is actually one of the very well documented concept. Men are totally preoccupied, predominantly preoccupied, much of the time preoccupied with sex. And cartoons are there which actually document that. In fact, this is actually the complaint from the woman that either he's interested in the sex or sport or TV remote and a whole lot of lame excuses to give. And there is a small area referable to for the family and all that. These are all extremely commonly reported this thing. There is a strong association between food and sex. I'll come to this little more. When a photo video was related to the child, there is actually something which actually links. Later, if certain questions come, I'll try to elaborate on this particular point a little more in detail. And we are all well aware that people, when they eat non-vegetarian food, people also talk about non-vegetarian jokes and things like that. In fact, women not so much favored, or in fact, they don't eat non-veg food, or in fact, non-veg goes along with alcohol, whether there is one which actually is of such issues related. Concepts are still not clear. We'll come to this particular point. But what I was trying to convey the message to you, there is a strong link between some of these type of things. And when you are trying to talk about sexual addiction, you take it for granted there is 2 or 3 or 4 other different addictions are there associated with that. It is almost always a combination of things actually which go in that particular fashion. So there is a wide difference between men and women's brain. Sex is one of the predominant aspects attributed to male sex. There are multiple addictions. COVID-19. In fact, we are all worried about the pandemic and all lot of related problems it actually created. But let me tell you, there is another pandemic waiting to happen. I am yet to come across any parents coming and telling that, in fact, they don't have problems with the children. Everybody is worried because the children on internet and a whole lot of such other things. How actually to get them out of? How actually to make them productive? How actually to make them constructive? In fact, these are all certain actually aspects. And we ourselves, see, you just imagine you don't have mobile and how you can. aware of certain consultants when they are talking to the patients and all, like, in fact, they don't use mobile. I'm aware of certain people who are actually in the meeting. They don't, majority of the people, whether one of the very important meeting may be going on or a whole lot of things might be happening. In fact, without mobile, we are almost unable to live. Among all the vital important things necessary for our very survival, now mobile is actually one of the things which has actually joined this whole process. So the COVID, not only it has brought in so many other things and the whole range of things, it has affected us. It has affected all aspects of us. This is one of the very important points. When we are, it has to satisfy few important points. Salience, that means this particular substance or this particular behavior becomes one of the most important aspects of one's life. People develop tolerance. You are watching it for a little while and now all your reading time, your consultation time, and a whole lot of these things actually takes occupied by this thing. Without it, you feel you have lost something very significant. Withdrawal symptoms. Range of conflicts which are associated with that. In fact, if you take the mobile, take the individual from the internet, in fact, the whole lot of things actually will happen. The relapse, what we talk about. What is this exactly meaning? As we try to keep on discussing, we'll try to look at it. During COVID time, we used to talk about people should wash their hands for minimum for 20 seconds. It became few minutes to, in fact, if somebody is actually predisposed to certain things, this habit itself can become some of the major important common problem, leading to quite a bit of difficulties.
Hey, what's up?
I'm fine.
कहाँ जा रही हो?
Who the hell are you?
तुमने मुझे नहीं पहचाना?
Danish.
COVID has made us actually forget. Just I was bringing you to the focus that there are multiple. So when we are using the word addiction, behavior that can function both to produce pleasure and to reduce painful effects. What actually it is? Recurrent failure to control the behavior, continuation of the behavior despite significant harmful consequences. If we are able to establish these 2 points, then we are labeling this as actually the addiction. When and how this particular range, what we basically call when to draw this particular line, is actually so very bit of difficulty. As far as sex is concerned, we're all sure that it is actually something special. Everybody longs for it. Whatever it is, good or bad, but there is nothing exactly like it. In fact, this is what actually the Fields who had mentioned. Now, the question is whether does sexual addiction exist? Describe this phenomenon. We'll try to look into what it is. Some people believe that it is actually indicator of one or other disorder. Something basically, primarily, this is actually the present. This is one of the very important aspects. So either part of obsessions or impulse control disorder or range of other psychiatric disorders, what we basically call, say, for example, somebody gets into a mania. He becomes overactive, hypersexual, and a whole lot of such these things. And other exceptions may be, say, Kluver-Bucy syndrome, you must have heard of, where the destruction of amygdala at both the sides, what was documented in case of animals earlier, psychic blindness, excessive eating, hypersexuality, and many other such these things. So, those organic and other special conditions and disorders, we'll just keep it aside. Let us look into what actually we find it in the general population. Beforehand, let us first rule it out what is not actually the hypersexuality, sexual addiction, things like that. One is moral issue. Sex is bad. Sex outside the many other such moral issues people talk about. But there are people who believe that as a human being, we are all animals and we are actually entitled to many of these things. So we are not dealing with in that particular fashion. Sex itself is something wrong to something extremely good. In fact, that is not our discussion. Each religion may have a different stance that the affairs and lot many other things what we talk about, right or wrong and all. Like, in fact, we are not going to get into that particular. Sex gives fun and pleasure. How much? How much extent one should go? Of course, we'll try to look into. Fetishes and paraphilias are common in the society. Let me tell you, we had one the place where we were staying earlier when we came to Mandya. About 3 to 4 houses beyond that, there was a family, and on and off we used to meet, and absolutely we had no issue. We never thought that there is something abnormal. Later, about nearly developed some liver problem, some malignancy, and he died. That is the time, in fact, the wife was telling, in fact, he had life. In fact, the wife was actually happy with that because he used to give her what we call the lash to give repeatedly the pain and a whole lot of the type of a thing. He used to have sex with whatever red thing looks like, and in the house. In fact, she was so much feeling type of things, and quite a few other behaviors. So, for a sexologist, a neighbor, and recognizing he had actually had the problem, it took almost about 10 years. And that too because of some specific occasion wherein actually the description was available. Can you imagine? We won't even know what is actually happening. What is there for the public glare is actually something totally different from what individual is actually leading a life like. Same-sex interest. People used to believe that this type of gender-related problems are more, and we are not going to get into that type of a discussion at all. Sexual offenses are a different domain altogether. In fact, here the rule of law comes into the picture. Say there is something like incest. There is something like bestiality. There is something called anal sex, which may be actually normal. But their law says it is actually something problematic, means it is a problem. And deviations. Hundreds of deviations people have documented. Absolutely. In fact, they are not part of what we basically call sexual. Actually, we are trying to look into. The whole issue is we definitely need to have a proper idea what is actually normal, when actually can something called as a little more excess, when actually something called as a problem that needs attention. So a basic understanding is necessary. And you as gynecologists and OBG specialists, you are going to deal with quite a few people. A partner must have come and told you, Why actually her difficulties in the family? Because the type of difficulties what she is getting into. In fact, these are all the things what actually one definitely need to. In fact, because this is the time I just added this particular picture. Hefna, Playboy mics. You might have heard of. Absolutely. In fact, there are actually the playgirls telling that this particular person was having so many problems. People have documented. Sexually, whether performance-wise, there was difficulty. Way, what we see on the surface and what actually the individual himself, for him, Playboy, this was actually a business. In fact, many people were hooked to a lot of things, actually, what he was talking about and doing. But all said and done, when actually to draw the line, whether what actually indicates something specific, very difficult to document. So let us look into a little more extra when actually, how actually one can talk about. They are a little curious to know about what is actually happening. This is not abnormal. This should be taken as normal. This indicates something actually a problem going to happen a little later. Absolutely, one need not have to think in that particular line at all. No sex education. People have, this is not attributable to anything abnormal at all. So sexual addiction, this particular concept is there. When actually, how actually one should deal with this, we'll try to look into some of this type of things in a clear perspective. There are different terms used for this. You will be surprised to know there are so many terms are there. Which one actually to be used? Hypersexual behavior. This is one of the most recent terminology in certain classifications in vogue at present. Hyperphilia. Moni had given this particular terminology. Compulsive sexual behavior by Coleman. Sexual addiction by Carnes. Impulsive sexual behavior by McRoy and et al. Problematic hypersexuality, Gold and Heffernan. So these are all different terminologies actually people have used, and what is that? Sorry. Out of control behavior. This is one more actually terminology which was used. Looking back a little more into historical aspect, see, unmanageable sexuality has been described clinically for over 200 years because this is actually a documented history that is available. Talks about sexual appetite when excessive becomes a disease both of the body and mind. And father of sexuality, in fact, Havelock Ellis, in fact, his book on psychology of sex is actually one of the earliest scientific elaboration to, in fact, sexual history of the world by Hirschfeld and what we basically Kraft Ebbing. These people produced a range of publications wherein actually the previous, what are the abnormal behaviors, what we consider now as paraphilias and all of that, they were. Definition of paraphilia. Paraphilia is one wherein, in fact, some particular aspect which is not alive, which is not accepted. 30 minutes. The third one, giving pleasure, pain or receiving pain and such other related things. Individual's life to a great extent, and he would seek that. They were called as paraphilics. So one of the old terminologies, repeatedly what they were talking was compulsive masturbation, common behavior in their clinical samples. And two terminologies that came into being, what is called as Don Juanism or satyriasis in case of males, and nymphomania in case of females. See, Don Juan is one of the movie that came up wherein he had multiple encounters. If you try to look at, for example, Harold Robbins' book, 200 other such books which are available, they talk about multiple adventures people actually try to carry on. Casanova, in fact, his adventures, particularly in the country France, very well documented historically speaking, that he had multiple affairs and what all the ways actually he used to with ladies too. In fact, any one of these different activities documented, that multiple partners, multiple type of activities, these are all present in society. So when you are trying to look at modern sexuality, there are a few things what we have to keep it in mind. Primarily, if you try to look at lot of cases, what we come across, they are all inhibitory type, wherein actually there is a difficulty. Either man is not able to perform or woman is not able to reach orgasm, and in fact, in between whole lot of things. When you are trying to talk about second, like it is disinhibited and lot many other things, actually the individual presents, which is in excess, more than actually the partner can tolerate or the society can manage, and many other such concepts. So the modern society is moving towards inhibition to a great extent. There may be exceptions wherein actually the hypersexual behavior documented. But primarily, in fact, earlier days, much of the description was, in fact, historically keeping about 100 years ago to 150 years ago, primarily predominantly about oddness in the behavior. The term problematic hypersexuality, the last one what I mentioned, in fact, what actually he defined was loss of control over sexual fantasies, urges, and behaviors, and accompanied by adverse consequences and or personal distress to the individual. So hypersexuality as such is not abnormality, but wherein, in fact, he loses control. That is one aspect of it. Second, consequences could be bad, or he feels bad about what he actually did. So the need for diagnosis in variety of adverse social, physical, and legal consequences. In fact, time to time, whether you are talking about harassment, sexual harassment, to, in fact, majority of the things, day in, day out, we read about rape and such other things. Wherein actually to fix up these individuals. In fact, all TV channels and everything about a 12-year-old girl raped, and she was, in fact, moving around almost for about 2 kilometers in where actually we come to a class. We'll come to that point later. In sexual addiction, individuals experience similar affective dysregulation, just like what we mentioned about problematic hypersexuality. There is a behavioral inhibition, means it affects lot many other behaviors. Reward for behavioral addictions as they do to chemicals, because sexual behavior gives high. Individual seeks it again and again. Individuals with sexual addiction experience negative consequences. They go through significant personal distress. They feel guilty. This is actually very well documented. Why actually we should be concerned about? Sexual offenders, to a great extent, they'll end up with this particular thing. There are studies actually that they may be having one extra Y chromosome. Majority of the jail population, when they have done analysis, in fact, they have documented, more particularly those individuals sexual related crimes, that an additional Y chromosome present. And you might have been aware that not gender neutral. Primarily, any sexual offense, in fact, it was attributed to the male sex. Individuals with HIV, in fact, these are all people who are likely to land up with this thing. Significant depression, suicides, and other related problems. More than anything else, relationship instability, sexually transmitted infections were very commonly documented. Let us confine now to what we basically call sexual addiction. That is the terminology that was used. I may be actually moving from here there because hypersexual, they may be having similarities to a great extent, and these are all different terms given by different authors. Gans, in fact, he mentioned about sexual addiction. What it actually meant was recent shift of addictive disorders from substance-based to a broader category of potentially addictive disorders, popularized by Patrick Kahn's in the Out of Shadows, Understanding Sexual Addictions. What he mentions is, sexual addiction is a legitimate condition analogous to substance addiction, character and dependence. It meets almost all the criteria. This particular figure I have simplified to a great extent to document that very highly reported masturbatory, voyeuristic, obsessional, anonymous sex and pay for sex among these individuals. So even this is actually the case even with certain substance addictions also. You take an alcoholic, you take many of the other substances, almost the same features actually you are likely to get. To depression, anger, anxiety, insomnia, fatigue, that means distress is extremely common. That means these are the two important messages at this particular juncture I would like to convey to you, that these actually produce a mixture of clinical features. The second, they produce a range of psychiatric problems. Major changes, addictions-related disorders, substance-related disorders, and pathological gambling in the current classification. And the DSM, if you are to do that, hypersexual instead of the term sexual addiction. When and how actually, in fact, the criterions wise, we can come to that conclusion. I'll come to that. And this is a vague concept without many clear points at all to document. From psychiatric perspective, we should keep three problems in mind. One is addiction spectrum disorder. What we have mentioning a few minutes earlier in the beginning, that it could be alcohol. When alcoholic means he might have used nicotine commonly. He might have used the ganja on and off. He might have used opioids. He might have used now let's look into two more: impulse control disorder and OCD spectrum disorder. These were there, historically speaking, as some of the major common components of what we basically call sexual addiction disorder. What are these impulse control disorders? Failure to resist impulses, urges to perform an act. That means the brain, see, for example, in our brain, there is something called as inhibitory system and there is something called as excitatory system. Appetite, take an example. One should feel also has to be another center which is called as satiety center, which actually puts the brake. Now you are full and there is no more eating necessary. This can get affected by so many things. Say, for example, if somebody is having sleep apnea, many of the times they'll end up with the whole range of syndromes, wherein obesity to breathing difficulties to, in fact, excessive eating. These are all very commonly documented. Rise in tension or arousal before committing the act and relief or pleasure after that. This most start in adolescence and are chronic. Almost never is just one problem. In fact, invariably, they will end up with a whole range of disorders, what we call multiple disorders are part and parcel of this particular phenomenon. So impulse control disorder means, say, let me tell you, sexual addiction disorders or hypersexuality is included under that, but there are a few classically named syndromes are available in this category. Intermittent explore, but suddenly he becomes so excited and disturbing actually that he may kill somebody, do a lot of things, can land up with a lot of, in fact, legally not permissible activities. Kleptomania, maybe from the very high class and all things like that, but stealing some small item in a mall and all these type of things, getting caught, whole lot of explanations are available for it. Pyromania. In fact, I remember at least about 3 cases wherein we never knew that the fires that happened in different syndrome, they are there in psychiatric practice. Pathological gambling. In fact, I still remember there was a family and wife wanted him, that Veerappan. He was posted as one of the teams in capturing him. Once he comes back to the city, taking off or in fact given permission, invariably will run to the one of the gambling dens or the horse racing and will spend whatever money is there. And wife repeatedly used to, in fact, she had made a request posted there in the forest. Trichotillomania. In fact, plucking the hairs, hairs on the scalp, hairs on the eyebrows, hairs on the chest, hairs on the genital area. These are all actually extremely common. Impulse control disorder is non-specific. What actually happens in these individuals, there is an urge to do something. It builds up tension. Individual has to act. In fact, he gets relief after that particular act. This is actually about impulse control. They may present with whole lot of things. Actually, it may be lying, it may be stealing, it may be starting fires. In fact, the range of behaviors people have documented. When you go into the details, you can find that almost all major psychiatric disorders are actually can be represented in this particular phenomenon. Obsessive spectrum. This is the second one what I was trying to talk about. Obsessions, you are all well aware. To remind you what we were taught you in obsessions are, say for example, I am all the time thinking about, say, my girlfriend, my wife, or my muse, whatever it is. All the time it is there. That is not obsessions. Obsessions refers to recurring ideas, images, impulses. They produce anxiety. They are silly. I don't like that. More I try to control, I become anxious. More I try to control, more anxious. And it compels me to times. One of the classical example is given is, you keep your right leg and go out. You go to the temple before exams. Majority of these type of things could be obsessions related only. But much more than anything else, many of the times, say for example, repeatedly washing hands, repeatedly arranging things, repeatedly doing a lot of things. All these things are related to the fact that, say for example, I believe that this fan on my head is going to fall on me. There is no reason to believe. It's because it is a silly idea. But I believe that particular way. More I try to control, more anxious I become. Now I tap 3 times and I say Ganpati, Ganpati, Ganpati. Now it won't fall on my head. This is what precisely about. So in obsessions, they are invariably associated with the range of what we call compulsive behaviors. So this has been actually one of the things which has been attributed. One may be celebrity, but this could be one of the very commonly reported. See, here the person believes, because I prayed in some particular fashion and prayed for a certain length of time. That's why he hit the 4. That's why he hit the 6. What is the connection? You may wonder why actually somebody is connecting in that particular fashion. But this is actually indicators of what we basically call obsession related. Usually call it as actually called as spectrum. So coming to sexual addiction, prevalence, causes, and treatment, what are the data available? Let me do some of the terminologies. Sex addicts come from all walks of life. It could be male or female, young or old, CEO to farmer, almost urban or rural dwelling, anybody can be. Sex addiction does not discriminate. Anybody can be exposed, and particularly in some individuals, it can be one of the very important aspects. Sexually, physically, or emotionally. Many grew up in families in which addiction already flourished, including alcoholism, drugs, gambling, and compulsive eating, and many other such other things. Most grapple with other addictions in addition to sex addiction. And they find overcoming sexual addiction one of the most difficult among all the addictions what actually they might be having. So these are all certain important universal comments what actually one can talk about. largely this has been ignored. Even by a problem can create quite a bit of difficulty. A lack of empirical evidence on sexual addiction is the result of the disorder's complete absence from the versions of DSM-5. If you try to look at the current classification has removed this particular terminology, sexual addiction. DSM-5. See, for example, desire disorders, arousal disorders, orgasm disorders. In case of women, little difficult, interest and arousal disorder, what was mentioned, and pelvic pain and penetration disorders. This has removed sexual aversion disorder. Sexual aversion disorder, now it has been put under disorder, has been knocked off. Last one, paraphilias. Now there is a division called as paraphilias and paraphilic disorder. What it means is some paraphilias, which are actually a little odd, or what we basically call creating problem, but significantly to a great extent confined to the individual, and individual also can carry on with his usual activities without much difficulty if it is at a particular level. They were all called as paraphilia. Need actually treatment. Paraphilic disorder, when individual or the others concerned, society, family is affected. This actually definitely needs treatment. If we look at prevalence, the existing prevalence rates of sexual addiction related disorders range from 3 to 6%. Absolutely no relevance at all, because we really don't know how far actually this particular concept and how actually this has been arrived at. Why? Sexual addiction and hypersexual disorder is an umbrella construct to encompass various problematic behaviors. It encompasses various problematic behaviors, including excessive masturbation, cybersex, pornography use, sexual behaviors with consenting adults, sexting, strip club visitation, prostitution, and other behavior. That means, wherever studies have been done, the data obtained is not clear. Many people might be telling lies, and many other such things. You just try to look at, for example, affairs, extramarital affair. One of the things is, in case of male, there are no extramarital affair. It only indicates lack of opportunity. Many of the times, in fact, the available data, 80, 90, almost 95, that another 2% or 10% or 20%, they were supposed to be telling lies. This is actually for the females. Earlier reported figure in one of the partner study was around 50-55%. Now the data reports actually indicate that maybe around 80-90%. They are just slightly behind actually what you call male. What it means is the world is changing, cultures are changing, and this is one of the major problems. And what is actually the biology? I'll not go into too many details because the range of psychiatric disorders, one may have to talk on this particular area. But what actually happens, biologically speaking, see, the sex center is like drugs or any pleasure giving, what we basically call the substance. So whether you're talking about cocaine, heroin, nicotine, alcohol, there are certain specific areas which are actually affected. What are they? Prefrontal cortex, septum, hypothalamus, and more particularly nucleus accumbens, amygdala, and in fact, the whole circuitry around that is considered as one of the responsible this thing. What is actually the substance? Dopamine. But some other things, the one actually substance which has been actually produced is actually dopamine, which triggers certain things. Dopamine high. If there are addiction to food we are trying to talk about, sugar is one of the major common source of what you call, which can produce dopamine high. So dopamine is one of the most important component which is actually responsible for many of the things. Dopamine is necessary for us. This is an executive neurotransmitter. What it means is, I am getting up, standing, talking to you. All of these things are excessive triggering in certain particular areas. If it acts, certain particular bundles which are involved. This is what referred to as reward circuitry, leads to what we basically call as addiction. There are experiments at this particular level, you just press it, the rat eats excessively. In fact, so much so that in a very short while, in fact, it has put on so much of weight. Sexual behavior and lot many other things. In fact, the center is ultimately the same one. For people who fantasies and urges, if they meet some of these criteria to the point of distress or impairment, they engage in activities such as porn, masturbation, sex for pay, and multiple partners, among others, as I have mentioned already also. They may feel distress in areas of life, including work, school, and relationship. Then this hypersexual or, in fact, sexual addiction disorder. Let me elaborate a little more. Each of these sentences are self-explanatory sentences also. Recurrent failure to resist sexual impulses. Extent over a longer period than intended. Long-standing desire or a history of unsuccessful efforts to stop, reduce, control sexual behaviors. Spent excessive time obtaining sex, being sexual, recovering from sexual experiences. Obsessed with preparing for sexual activities. Frequently engaged in sexual behavior and expected to be fulfilling occupational, academic, domestic, and social obligations. Continued sexual behavior despite knowing it has caused psychological and physical problems. Increased intensity, frequency, number, and risk-taking sexual behaviors to achieve the desired effect or experiences diminished effect when continuing behaviors at the same level of intensity, frequency, and number. Given up or limited social, occupational, recreational activities. He becomes upset, anxious, restless, and irritable if unable to engage in sexual behavior. See, these are all the points. There are scales available when actually we can call it. I'll come. This particular phenomenon, where to draw line, amount of vagueness is actually there, is actually straight away. Unless a person feels is actually producing problems, in fact, he is getting into distress, in fact, we won't even know. The concept of sexuality is under heated debate. Currently in ICD-11, compulsive sexual behavior disorder has been added. People are asking why this particular thing. See, for example, to make a diagnosis and classification system. This may be to regulate behavior, or we are just talking about just increased sexual drive, simple impulse control problem, simple obsession compulsive related phenomenon. These are all the few things we'll try to elaborate. Now I'll little digress a small extent because you gynecologists should be aware of what we actually are trying to talk about. See, there are few things. Men and women, there are few differences in certain areas. Arousal, orgasm. See, orgasm is same. Like a very long route. Men are fast on the gun, and in fact, their activity behaves a little differently. Fetishes, pornography, sexual boredom, which men feel, female passivity, differences in sex drive, and range of behaviors. Let us look into a small thing because though it looks like a little digression, this can make this whole presentation a little more interesting, and it conveys some specific ideas to you. See, many men believe that sex means it is actually, in fact, the terminology for them. Women actually go after something different, but men actually think quite a little differently. If you try to look at libido, invariably at any given time, women are at a lower level. In fact, this is what actually the whole data talks about. This is one of the reasons why, in fact, a person marrying, that means a woman marrying a man who is 2 or 4 years older than her, is one of the best sexual combination compared to what actually the society believes. A girl should be, when a 70-year-old man is asked about marrying a girl, he wants a 16-year-old, sweet 16 range of girl for him. People are not aware of what is actually happening. Sexual drive. See, men's drive is almost always documented to be high because this is actually testosterone dependent. Orgasm, intercourse are invariably linked. Positive reinforcement is available. They can enjoy lustful and want sex because that's what actually society expects. And upbringing actually contributes. More sex, have more partners, consistently documented among all cultures, have more sexual dysfunction as they age. Look at women. Female sexual drive is actually passive or receptive drive. Come hither. In fact, this is actually the story, but all said and done, the range of difficulties get into because intercourse, intense pleasure, not linked. For many, difficult to achieve orgasm. Less sexual frustration. Primarily, predominantly, they are very much happy with the sentimentality. The reasons, inhibitory female sexuality, the management is actually by training the woman in masturbation and a whole lot of other such things. For them, it is a duty than joyous and pleasurable thing. Traditional societies discourage sex. And we are all well aware the hormones produce a whole lot of problems. Even in one single particular sexual cycle, the woman is highly active, supposed to be with the onset of menses, somewhere mid-cycle with at the time of ovulation. And premenstrually, the least sexually, this leads to what? Desire for sex more often linked to the relationship status and social norms. At all ages, women more likely to report sexual dysfunction. Let us look into 1 or 2, 3 important points that way. See, when you are trying to talk about management, a little bit of these type of figures, videos actually may stay in your head, and in fact, making decision would be easy. See, look at our even Prime Minister, any other person. In fact, this is actually the typical story of men. Men get aroused very easily. They can be treated also because of the same reason. But women, in fact, all erectogenic tissues are distributed. One of the terminology used by one of the senior gynecologists in this particular program, that erogenous zones, they are distributed far and wide. So these are a few important points as far as the what we call as the drive is concerned. Coming to the fetishes, men more likely to be exhibitionists. Fetishes and pedophiles, in fact, pedophilias, they are actually, in fact, extremely commonly reported in case of men, hardly reported in case of female. Pornography and related things, I'll come to 1 or 2 minutes later. Let us start with exhibitions. When I say that men are exhibitionists, see, look at this particular photo. Women are exhibitionists or men are exhibitors? In fact, you may be scratching your head. We see the exposure, cleavage, and lot many other things. People, in fact, the fashion has gone to an extent that, in fact, there are only sleeves. There is nothing else. So people believe that women are more exhibitionists, but science, biology speaks, the men are more exhibitionists. I'll come to that 1 or 2 minutes later. Coming to these pictures, what I have projected, these are all indicators of 2 things from psychiatric perspective. What it means is, say, for example, narcissism personality. In fact, to attract the male, the animals have to do a lot of things. See, in case of animals, it is very well plumed and colorful, these things and all. In fact, it is actually all attributed to the female. Men and women, in fact, coming to the woman, we can't have feathers and all that type of things. In fact, you have to wear a sari. You have to expose certain things actually to attract. I'm not telling that these are all done with intention, but all said and done, unconsciously, a lot of things happen. Freud, next to a great extent, the range of sexual difficulties, whether we are talking about conversion, dissociative disorders, and many other such what we symptomatology in the individual, particularly the females present, has been attributed to this particular fact that, in fact, to attract the man, attract the father, in fact, this is what actually ultimately it boils down to. But when something comes near, that father figure comes into the picture, and that's where it generates a whole lot of anxiety, and they actually freeze. And all these type of disorders which have been documented. We men fall in love with those people who are having a little more histrionic traits. This may be attributed to film actresses in general, to extraordinary great actors, but all said and done, when you are trying to talk about sexuality, they will be the least interested individuals in this particular whole area. If somebody asks me this question a little later, the economy related to this, I'll come 1 or 2 minutes later. Men are exhibitionists. In fact, this is one of the very exposing. That means there is something to hoist. In fact, this is one of the very common story. See, well, look at woman, almost under lock and key. This is actually the story even with animals too. I still remember my mother had given a bit of biscuits and a little bit of milk for two small puppies. When they grew up, one was male and one was female. When the gate is closed, this fellow will jump the compound wall and meets 2 or 3 of his girlfriends and comes back. This female dog, you keep the door open. You have a girl at home, you will find there is a whole lot of difference. Now the culture, things might be changing to some extent, but all said and done, almost always women carried certain risks. Almost always, a lot of emphasis was on relationship, intimacy, and such other related things. And being inhibited is one of the very typical story. Even if you try to, in fact, I can almost about 1,000 photos I can present here to document what I am trying to tell. Almost always under lock and key. Typical story, whether you are talking about animals or the human beings. And women, the process of reaching orgasm is actually something, it is a very long course. One of the very typical story, in fact, what we actually have seen in many romantic situations, but I have noticed also that women close their eyes. Why? In fact, to feel, experience, in fact, the erotogenic tissues to get stimulated and experience this thing. Unless you close and concentrate, it is not possible to reach. And this is about anorgasmia, arousal-related disorders, and many other things. In case of female, the drugs won't act. In fact, a whole lot of therapy is related to that, what we talk about, what we basically call sensate focus and such other exercises. They become extremely important components. Men keep their eyes wide open because after this female, who is coming next? They have to keep a track of. This is one of the very typical story. I can quote again any number of photographs taken. These are all taken from the usual classic magazines, popular magazines. But he's a dirty old man, what we talk about. Two, in fact, being, in fact, many women find it very difficult that this particular fellow's behavior. Maybe, in fact, in case of man, it's testosterone dependent and it starts very early. However, beautiful wife, pornography, another thing. In fact, many women actually, they look forward to Mills and Bones related stories and in fact, even videos. Men like hard stuff. In fact, this is one of the very classically documented. You talk about fraternism to rape and a whole lot of things in between. Significant domain is related to the male sex. Historically, it has been documented, and even today, the data. All weaknesses of man, and alcohol, you talk about smoke, you talk about women, you talk about gambling. Almost always, majority of these things have been documented in case of male sex. Men get bored with sex. This is one of the reasons why the hypersexuality, how we have to put the line. Basically, they are meant in that particular fashion. He has to sow his words everywhere. In fact, this is there is only one perfect wife in the world, and every neighbor has it. In fact, this is the story. You have to protect oneself.
Hi, baby. Alex and Jimmy are asleep. How's work?
Don't forget about work. Sit down. Here we go. Happy anniversary.
Oh, Jerry.
I saved my pennies. You like it?
Oh, Jerry, I love it. Now, I have something for you, too.
Okay.
Now, I know that since the kids were born, our sex life has cooled down. So tonight, on our anniversary, I'm going to give you something you've been wanting for a long time. And I know we can't afford it, but I've been saving up too, so don't ask any questions. Just enjoy it. Allison. Happy anniversary.
Yeah.
Isn't she great? I want this night to be a night that you remember forever.
Oh, wow. Yeah. No, it's great. Wow, I'm gonna love this. Okay, come here. Oh my God. Wow, honey, I've been dreaming about this for so long. All right, well. What?
You and I could go to a hotel tonight alone.
Oh, wow.
This is the story. In fact, men almost always think about so being little more
Was gaat er nou dus? Ja, zeg. Waar is jouw steek? Zijn. Actually, that's what I'm doing. Everything is a year. Influence.
basically male sex is attributed to this particular fact that they need more sex, and this particular idea persists. And women are actually suspicious of husbands because of the whole range of inadequacies which may be associated. Men actually were suspicious of their partners and women in general, not because of anything, but they are aware that they can win anybody. That means any other man also can actually do the same. This female passivity. This is one more important point I just want to say.
My name is Atulya. I work in digital communication. My question is really simple. What excites you the most?
That's the most difficult question. How can I say that publicly?
Men, they are actually fast on the gun. But what is actually being reported is men are like tube lights in a whole lot of things in their life. But when it comes to sex, they are like incandescent bulb. And women, Stree means actually, in fact, people say that it is like iron box. Stree means history. Slowly it heats up, multi-orgasmic, what precisely the Boston Johnson's work. But what is actually the current, females can experience multiple orgasms, or in fact, very passively they can participate without experiencing anything. So there's a wide difference between men and women. Love first, sex next is the story of a woman, means sex first, love next. And
to my wife, during the last year, I have attempted to make love to you 365 times. I succeeded 36 times. This averages once every 10 days. And the following is a list of reasons why I did not succeed. It's too hot, 15 times. It's too cold, 3 times. I'm too tired, 19 times. It's too late, 16 times. Pretending to sleep, 35 times. I'm not in the mood, 21 times. Mind my hair, 28 times. Is that all you think about? 83 times.
so you think only about sex, and more particularly, you want acrobatics. See, many of the times, I'm going to a little bit of the story. What man was not getting, the neighbor was able to give, is one of the very common story. She may be one of the most beautiful women at home, but not so good looking woman actually comes and occupies that vacancy because simple reason that she was able to give him a blowjob. She was actually more active. She was more concerned about sex, and many of these type of things happen in the relationship. And one of the major common things is actually the pregnancy and then the delivery, wherein almost sexual interest attributed to again prolactin and such other hormones and neurotransmitters. And many extramarital affairs happening at this particular time has been very well documented. Women expect too much of these things, and that's where actually the whole lot of difficulty starts. Romance, sentimentality, and many other such things. And this is one of the reasons: seduction, sensation, surrender, not many other such what we basically call the romantic related to those things. And look at that woman's sexual response cycle. It is possible. As I was earlier in sex therapy related area. Hello? Anything in particular? I can continue?
Yes, sir, continue.
Continue, okay. So a block can happen many times. Even at the peak of sexual responsiveness, in fact, she may be worried about the child's bag, and there is a difference between men and women, which actually we need to document. For a man, anything female moving and alive is more than sufficient. But for a woman, a lot of other things are which are necessary. And this is one of the things, when we are trying to talk about hypersexuality, we need to keep it in mind, this particular difference. Coming to the evaluation, detailed history is extremely important. Giving him confidence and assurance and other related things are extremely important for getting information. Physical examination must always be done to rule out, and to talk about hormone and such other related things. This is extremely important that you rule out anything which could be actually worse. There are multiple scales are available, but let me not go into too many details at this particular juncture for the gynecologist. The pathos items. Do you often find yourself preoccupied with sexual thoughts? It talks about preoccupation. Do you hide some of your sexual behaviors from others? That's why he feels ashamed, and it's important for making diagnosis. Have you ever sought help for sexual behavior you did not like? The treatment related issue because of your sexual behavior. Hurt. Do you feel controlled by your sexual desire? That means it has gone out of control. When you have sex, do you feel depressed afterwards? The sad or distress. A positive response to more than 3 questions indicate need for further assessment. There are political scales are available: sexual addiction screening scale, sexual compulsivity scale, hypersexual behavior inventory, sexual outlet inventory, compulsive sexual behavior inventory, and these are all the things. And what are the things what I'm going to tell? In fact, one can elaborate in a great detail, but the fantasy sex, preoccupation, seductive role sex, in fact, for conquest, multiple relations. In fact, people, if you read certain of the books, Sarah Drop-in, a few of the other things, books, in fact, people want multiple people to actually, in fact, I feel woman, if only the man shows interest, he is not showing interest, in fact, I feel get upset, leading to affairs, unsuccessful serial relationships. And stands, paying for sex, trading sex, voyeuristic sex, exhibitionistic sex, intrusive sex, touching others without permission, frotteurism, to using position and power, rape, whole range of such things are actually people have documented, which indicates there is a problem in certain areas. What actually documented is actually the sexual addiction well. What it means is the range of difficulties an individual can land up with. And what actually has also been addictive disorders. They commonly coexist with substance-related disorders, may themselves have features associated with addiction, respond to an addiction model of treatment and therapy, unrecognized, untreated symptoms lead to substance-related disorders, compulsive sexual behaviors correlated to HIV and other STDs. Certain common, certain infrequent disorders, what one should keep it in mind. It may not be too much important from a gynecologist's point of view, but extremely important. You must refer to this case and properly treated. There's a catalytic endowment. I'll just slightly elaborate. Most addicts come from families with addicts, and most have less than optimum attachment styles. You might have noticed in many of the marriages and all of that, in fact, men can understand the signal, and in fact, going for alcohol is one of the very common things. Most addicts report some type of abuse during childhood. Teachers' work has shown us how this abuse, in fact, alters the brain and a whole lot of things. Trauma factors. These are some of the factors that therapists look at when looking for etiology of the problem. Whole lot of problems, starting from physical to, in fact, emotional. Sexual addiction criteria. It has nothing to do with the amount or number of times a person has sex or masturbates, but primarily, predominantly, sexual addiction means automatically many of these type of things may be actually present. Sexual behaviors. Here are ways in which people act out when having a problem with sexual addiction. Fantasy, voyeurism, exhibitionism, seductive role, intrusive sex, you name, everything is possible there. Comorbid or co-occurring addictions are extremely common. Chemical dependency, eating disorders, compulsive behaviors, and so also. It is important to treat all of the addictions and how to understand how they are linked together. Cross addiction is actually extremely common and one should be aware of. Addiction cycle. In fact, Patrick talks about preoccupation, ritualization, compulsive sexual behavior, despair. I'll go into a little more into the details because the self-image is affected in these individuals. I'm basically a bad, unworthy person. Relationships, no one would love me as I am. Needs, my needs are never going to be met if I depend on others. And sexuality, sex is what actually leads to, or in fact, the system actually set for this. Addictive cycle is a part of the broader addictive system and consists of three more elements: faulty belief system, thinking errors, unmanageability. Faulty belief system. The basic core belief that feeds the addictive system is the lack of personal value. This leads to the lack of trust that others will be caring enough. Therefore, the addict believes that he or she has to be controlling in order to survive. And when sex gives care or sense of value or superiority, they think it is their only need and that is their best friend. So addictive cycle, people have documented belief system leading to what we basically call impaired thinking leading to what we basically call addictive cycle, and he feels unmanageable. This leads to what we basically call preoccupation. compulsive behavior, feeling guilty and other related things, and then and ultimately leading to what we basically call the shame, guilt, and a whole lot of such things which are associated with it. So in short, we have tried to cover important things. In medical profession, there are a few things which actually indicates professional actually getting involved with certain patients. Severe sexual acting out, history of sexual, physical, emotional abuse, and many of these type of things have been actually documented. Important issue, when a person has been brought, what is his pre-morbid sexual functioning? See, if an individual is having Parkinsonism, people have given him dopamine or dopamine donors and things like that. In fact, he can present with hypersexual behavior. Somebody, in fact, extremely good fellow, but in the jail, he may behave quite differently because that is the only way actually, in fact, he can find his important issue is what is actually his basic level. 3 levels of addiction. Graduate from one stage to another, not necessarily same order. Progression from one stage to another is dependent on psychological and personality factors. In an introvert, may remain in the masturbation stage forever. So there are 3 levels. In fact, I'll just try to elaborate on that thing. Level 1, fantasy, masturbation, affairs, prostitution, and things like that. Level 2, individual develops whole lot of issues, exhibitionism, voyeurism, indecent liberties, phone and cyber sex, bestiality, and things like that. Level 3, sexual offending, rape, incest, molestation, authority rape. So I have given a clear picture from one stage to the other, actually how they move about. Professionally, we can land up in problem. And in fact, Indian Psychiatric Society has published 2 guidelines related to boundary come about. So formation of this thing, some catalytic environment which triggers, actually people have documented, leading to what we basically call unmanageability, dependence, consequences, salience effect, because this forms one of the most important part of his life, and it gives him reward that he's controlling others. And in fact, I am something extraordinary. Nothing will happen to me. A reward is a reward, regardless of whether. How you can manage? Coming to the treatment, there are a range of pharmacological treatments are available, starting from fluoxetine, sertraline, naltrexone, and things like that. Anti-androgens in some individuals where unmanageable problem is present. Non-pharmacological treatment involves the range of psychosocial interventions. Psychosocial interventions, in fact, people have documented many things, starting from what we basically call, just like drug addiction, 12-step attendance, trauma assessment, group therapy, shame toolkit to process this thing. Make problem lists, make secret lists, read books on sex addiction and get the knowledge related to this. Sex addiction history, powerlessness, and many other related things. Damage control plan and disclosure plan. Sobriety challenges, physical exam, sex addiction matrix, sexual health matrix, and attend regular meeting sessions, and in fact, the therapist advice. That means it is a whole process that is involved in managing these individuals. There's initial task, middle level task, and what we basically call the third level task. May not be absolutely necessary in great detail for a gynecologist. That's why I will not go into too much of these things. Along with sexual addiction, internet addiction is actually extremely commonly associated. I will not go into the details related to this, except that just like hypersexual behavior and other related terminologies are there, internet addiction disorder, pathological internet use, compulsive internet use, so many other such things. One has to get out of it. Still in the group. One can be in the group, still feeling alone. And in many families, the laptops, mobiles, and TVs have disjointed to a great extent. And where now, in fact, the joint family means husband and wife living together. We be together, but again, predominantly, primarily associated with the mobile and its usage. Children are actually triggered very early age, where the girls becoming achieving menarche much earlier age attributed to one is the whole range of things. In fact, the light emitted, in fact, by the TV itself can be one of the major problems. So husband and wife living together itself, now it is actually joint family. They may be together, but hardly actually they in talking terms. Many of the times it is actually associated with porn. And just like many other terms are there, compulsive viewing, impulsive viewing, hypersexual disorder, many other terms have actually come into. And ultimately, majority of them lead to, see, if you just try to imagine, masturbation, the porn and a whole lot of other things actually could be beneficial. The drugs, say for example, opioids, produce a sexual dysfunction to a great extent. What it actually means is, because of this, the relationship suffers to a great extent, and this is one of the very commonly reported.
And nowadays in Singapore, there are a lot of women who are single, a lot of men who are also single because women don't understand men, men don't understand women. Let me explain to you, women. I know men. I was a man before. I'm still one shit. Men cannot multitask. Finish. Man, if you tell me you can multitask when you're having the morning poo in the toilet and using your Facebook, that is not multitask. Man cannot multitask because he can sit in a car, the friend sit next to him, they're driving the car. Then the friend say, hey, hot girl. He cannot reply because cannot multitask. When he reached the destination, then he, yeah, I saw. He like, who you saw? So long already. And man, if you don't understand, I'm almost there. Women are like dolls. If you're lucky, you get Barbie doll. If you're unlucky, you get Annabelle. I, with makeup, Barbie doll. Without makeup, Anne with bells.
So a whole lot of things are happening in life where help necessary. One of the message, in fact, you have come across somebody, don't neglect. In fact, this can lead to further and more complications. Internet, mobile, almost always problematic we used to talk about, but this could be one of the most important educational tool. In fact, there are actually good things also associated. Ultimately, the message what I am trying to convey, the hypersexuality, sexualization, and such other terminologies are extremely common, and we should be well aware of this particular concept. For the treatment of these problems, why for a gynecologist? In fact, to recognize something, refer to the professional, or in fact, to develop the wherewithal and knowledge and skills to manage these people. In fact, this is something wonderful. You are also so many professionals available, particularly gynecologists, who have shown interest in the sexual medicine, and that is, in fact, can bring about remarkable change. And from that particular angle, let me congratulate Neeraj Jadhav sir for a great effort what he has been putting in to see, and things look really better because Apuba, who was the right-hand man of Dr. Neeraj, what I can see, he is going to be in charge of this, and all the good reading, good exposure, and good skills for your clinical practice. Thank you very, very much for giving this wonderful opportunity for me to talk to you. I'll be there actually for any questions which are to be asked.
Samad?
Yes, thank
there
you.
is some
Thank
question
you
in the
so
chat box. Yes, you can.
I'm trying to get out of this.
Actually, one question was circulating in our sexual medicine group, sir.
Just a minute. There is some problem with the cursor. I am not able to use it on it.
Yeah, Apurak, you can, Samad, you can read from the chat box. There was one or two questions. I think in chat.
Yes, sir. Sir, before we conclude, should I ask that question, sir?
Yes.
Okay. Yeah. Sir, actually, these topics are very. I think I got few of patients.
Rao sir,
Hello?
just stop sharing.
Just a minute. I'm just trying to. Okay, I got it. Okay.
Yeah.
Okay, sir. I think I've not bored anybody. I tried my level best to.
Yes, it was very fantastic, sir. Yes, always it's mind-blowing. Your talk is, and we will have to go through 2 or 3 times to understand everything because it's not up for
It's a
the level.
pakka psychiatric topic.
We will need-
The important point is
Yeah.
pakka psychiatric topic.
Yes, sir.
It as simple as possible. That way, the gynecologist will follow this. Is a difficult task.
Yes. Yes, Amar. Question.
Yeah. Sir, actually, what happened now? Whenever you decided to have a lecture, psychosexual series on that particular topic, we are just, I always used to say, what sir will, give a lecture of 2 hours for this topic? Because we think that this topic is so just, but you made it so beautifully for so it and so palatable
Can
to
be
all of
open
us.
for 10 hours. If I can speak for 10 hours on this topic.
We know, sir. You can, sir.
Because each of these concepts, if you try to elaborate, for making understand these things, for a psychiatrist, of course, we may not be doing this much length of time because they're all trained in that area.
Yes, sir.
But for other things, why this particular concept came, how actually it progressed, and why actually, see, for example, men in general and women in general, this every family, this is the fight. Women think that man is almost always enjoying life and cannot be trusted and all common stories. But this is there in genes, that is there in hormones, that is there in the body. And when to put it? There are some very conservative people, even little bit straying here, there. In fact, they attribute it to such a big way too. There are a lot of other people, in fact, they are very comfortable with a whole lot of things. Any questions?
Yes, sir. Apura, put up the question.
Yes, sir.
Yeah, Sama. Yeah.
Yeah.
So actually, one of the
Sir, there's
questions.
actually a patient, and the patient is has the query, and she actually show a video of her 4-year-old daughter who is masturbating daily after returning from her lower KG classes. Okay, sir. Even doctor is when daughter is showing the video saying that it hurts her inside the vagina. That is why she is doing that. And that video shows that the girl keep her legs apart, doing the clitoral massage, and whole body of her is shivering after some time. The girl has no feeling of guilt or shameful after doing this act. So, on the local examination, vulva is clean, but the clitoral is enlarged for her age. The girl say that she gets pain and that is why she does it. So, it's a middle class educated family, live in a 2 BHK house, one elder brother who is 12 to 13-year old, and 4 of them are sleep together in one room. In another room, grandma is sleeping. It was in a surgery. Yeah. So, sir, wow, when it's a this type of patients are coming with these complaints. So, what it should be the line of management? What is the counseling? Because these type of patients, the parents are so much distressing and worried that what going wrong with their kid. So, sir, how will you deal these type of cases, and how will we counsel the parents?
Beautiful. In fact, when, I don't think any other better type of question can be asked for in a program like this. See, there are something common things need to be told, and there are some specific areas we look into. In fact, let me just take 1 or 2 minutes to explain this thing. I showed you the one child which is drinking the milk and he is meddling with his genitals. Starting from the very early age, anything which gives pleasure, any living organism will continue to do it. Unfortunately, in case of we human beings, we are bound by so many cultures, social, and that other related things, and we try to suppress certain things. Say if you try to go to a forest area and monkeys are there, what father is doing to the mother, what father is doing to his daughter, in fact, everything is actually common. We are all human beings, means we are all animals also. In fact, if you try to look at the limbic system, it is present. But when you say that this is something wrong, you should stop. In fact, the child may learn that this is actually something which should not be done. One, fine. Child may know that it should not be done, but that is the one which gives pleasure. Now he will start doing it from avoiding parents and in secrecy. The third one, he may get caught, or in fact, very clear critical parents are there, means he may feel guilty, feel bad, he did something wrong, and a whole lot of such things are going to happen. And many of the times, majority of the sexual problems, what we actually come across, has been seen in those individuals who are having a very good, rigid, strict disciplinary upbringing. Unfortunately, sexual problem is extremely high among these individuals. You try to talk about coronary artery disease, you try to talk about gastrointestinal disorders, you try to talk about sexual problems. All these problems are in those individuals who are called as type A personalities, who are dashing, who take up responsibility, who is good, who is conscientious, who is hardworking, who is disciplined, all good things. But these are the fellows who suffer from a range of disorders also. Okay, that is one aspect of it. The second one, in this particular 4-year-old child, and repeatedly this is happening, and one intersex condition which we all should gynecological practice. This is called as androgenized female. See, many of the times, if a fetus is in some problem, you try to give a lot of what you call drugs to protect the fetus. Ultimately, aromatization and remain a whole lot of things, if you try to look at, some of these things are metabolized to, in fact, testosterone also. What precisely happens is, if you try to look at, you are doing gynecological examination, PV exam, there are some individuals who have small clitoris, some individuals who have big clitoris. The range of things are possible, who are exposed to some of these drugs to protect. In fact, these are all grouped under, in fact, the first most common category, extremely common category among intersex conditions is actually what we call as androgenesis. From that particular angle, please collect the history, whether really something like that has happened. That is one aspect of it. The second one, if this particular problem is persisting, talking to the girl and trying to understand what it is, that is the second point. Engaging the child in a lot of other activities. In fact, I didn't go for the internet and other related behaviors, how we manage and all that. What we call as inhibition of certain activity means engaging them in certain activities which give pleasure. Sports, lot many other these things, wherein actually she is spending time with. In fact, that can actually prevent a problem, actually like masturbation and things like that, that can be diverted to some extent. If it is still persisting, many of these antidepressants, what we give at a very simple level, say something like fluoxetine, sertraline, paroxetine, small dose to a significant dosage, that itself can control. They have no problem with the whole lot of these things. And one which doesn't interfere with the girls, any of these hormonal metabolic processes is actually sertraline. The drug is totally free from, no interference with the menstrual cycles, no teratogenicity, no metabolic problems. So this is one of the most frequently suggested drug from, if it is a girl, to actually work on that. And there are a range of behavioral techniques are there. One is actually cognitive therapy too. In fact, 4-year-old child, how much, what extent we can actually do all these things. Maybe actually quite mature enough and she may be capable. So starting from education, cognitive behavior therapy to other behavior therapy techniques to overcome some of the behaviors are available that need to be done. Investigate and see that if there is anything related to, say for example, maybe CT, MRI may be necessary for this stage to rule out any intracranial pathology which may be actually contributing. May not be, but all said and done, if it is a tertiary care center, better to rule out if anything organic we are. A reasonable way. I can elaborate on, but that becomes very prolonged answer.
Very prolonged. Absolutely, sir. Sir, many a time this about a female, but I have seen even for my kids. In the morning, it's a way some that morning erections were there. It is common or it is abnormal? What, sir? Yeah, I just
Absolutely common.
answer
It
from
is. See, you look at, say, for example, testosterone metabolism. Testosterone is a hormone. It releases in the form of pulse. And usually in a given case, this can get altered for various other reasons, but usually starts around 6 a.m. in the morning. And it is released in the form of pulses every 20 minutes to 30 minutes. And this is one of the reasons why when we are making testosterone assessment, 3 samples to be collected, mixed and assessment done, because every 20 to 30 minutes, and one may miss out the pulse release and things like that. And this is one of the reasons all married people might be knowing early morning tumescence as one of the organicity problem.
absolutely.
And this is absolutely true. If somebody is getting morning erections, early morning erections in particular, that he is physiologically speaking normal individual. And many of the married people might be knowing, in fact, married females know that, in fact, man pulls her again back to the bed because he's having an erection. Many of the stories, what we can be seen. You want to know when actually women are maximally sexually stimulant?
Yes, sir. Please
Yes, sir.
elaborate.
Yes, sir.
What time? What time women are highly excited?
Nights.
Absolutely, totally wrong answer. No, you got the point. Night is the worst time for sex. Let me tell
Early
you,
morning.
I'm married to a gynecologist. When people call us for any of these reception and functions like that, by the time we go, already they are closing. No, you got the point. It works out advantage. Usually the husband and wife, they are tired, but also then they. So if it clicks means my wife gets the case. If it doesn't click means I get the case. No, you got the point. The advantages of marrying a gynecologist and going late for the function. So it can be a very good business proposition. See that. So women are highly excited during afternoon hours. This is the reason why those people who go for lunch to house where wife is waiting, those people look much better than many of us who actually leave in the morning and come back only in the night to the house. You got the point. The interesting things which women like, there is afternoon hours. Night is one of the worst possible time for sex. He is tired, she is tired, and the first night what we talk about is one of them actually made for creating problems. No, you got the point? So early morning erection, absolutely true, normal. It can be happening even in case of a child which is there in the abdomen also, fetus. Erections have been documented in case of the child.
Okay, sir.
So it should be changed terminology from first night to first morning.
No.
First afternoon.
One of the best time. And this is one of the reasons, see, for example, when I am treating certain individuals, unconsummated marriages and some difficult marriages are there, I admit them, not because of anything. They should get out of the whole this thing. Sir, we are having the house and we are having privacy at home. See, one of the most important plan for sex therapy is absolutely if there is any third person is there at home, to get the time for the afternoon and all. This is actually one of the peak time actually for the female and for the man. So just like honeymoon, they have to go out of this thing, even if they are there, however comfortable, however this thing, that bit of inhibition and other related things get into the picture. I admit them, take them out of the environment, because that's where we actually succeed. It may take about 2 weeks time, but we succeed in many of these cases.
And son, there is one another query. many times I get this query because when the woman is around 40 plus age, her husband is typically busy in a business or whatever work he is doing. So wife is getting so many ideal time, and at that time there is a increase in the libido in that phase of the life. So it is a common phenomena or
Yeah, beautiful question. In fact, this I have spoken earlier also. Sexual development. What Kinsey propounded. See, the girls actually achieve menarche 2 or 4 years. That means they enter puberty 2 or 4 years earlier than boys. But their sexual interest is 3 to 5 times less than boys. That means boys have 3 to 5 times more sexual interest in the adolescent period. Where it matches somewhere around 35 years, according to the Kinsey data. And I was telling in the beginning itself in one of my the woman marrying a man who is 2 or 4 years younger to her actually matches, because that's where actually it is. You look at somewhere around 40, 45. Man becomes slow for various reasons. One is age, metabolic problems, diabetes, hypertension, drugs, and things like that, alcohol, smoking, and other related things. Invariably, it is a downhill course. But as far as the woman is concerned, see, for example, she was inhibited. That's what actually we were trying to document many of the things. All those female hormones which were inhibitory, now by around 40, 45, they go off. There is a relative increase in testosterone. And this is one of the reasons why women become sexually more active. They start enjoying things. They become hypersexual, inverted comma. In fact, their demand actually, many men actually find it very difficult to meet. Absolutely normal. Second, men also preference and all happen at this particular time because somewhere naughty at 40, his sexual prowess is coming down, and that's why he wants to test it, different places, different women, various things like that. So what I can say is, women actually become extremely sexually active somewhere around 40, 50s. But still, there is almost always a problem, not because of biology, but because of the socio-cultural reasons. I have already concluded my life. Already children are grown up. My job, I'm no more a woman. No, you got the point? These are all unfortunate socio-cultural, religious, and so many other such things would get into the picture. I think I've answered your question. Yes. Absolutely normal, absolutely true.
But how to counsel them? Basically, I get...
No, it is normal. See, for example, the sexual release, that means this is where actually we have to talk to both husband and wife. We have to make him understand this is extremely important. The third, this thing is actually, in fact, many women, see, for example, when we did the study on about 500 plus women who are wives of Lions Club and Rotary Club members, and masturbation, only 32% reported masturbation sometime. Among them, only about 12% were reasonably comfortable. You look at the Western data, it is 60, 70%. Masturbation is extremely common. And for a woman, masturbation is one of the most common indicator whether she is responsive, how she is responsive, to what extent she can be responsive, and that itself can take care of a lot of things. But in case of our women, they have sexual desire, they feel excited, but they don't know that they can masturbate. They don't know that, in fact, this can be solved. Whole lot of burning vagina syndrome, burning sensation all over the body, multiple aches and pains, what actually women present. In fact, I use one of the very simple common terminology that this particular lady is not serviced properly. No, you got the point? Whether she uses masturbation, whether she uses a sex site, whether she, in fact, her husband is not there, she is widowed. There is a range of methods by which actually she can relieve herself. But many women, they don't know that it can be done. In fact, they come with headache, body ache, burning sensation, 100 other such things. And in fact, the doctors write repeatedly many of these things. So one is collecting proper history. There are multiple ways actually this particular relief can be. So for example, when we are trying to about anorgasmia, that particular terminology has to be knocked off according to the current literature. This is called as pre-orgasmic. Frigidity is now used as pre-orgasmic. That means if the proper stimulation, that in fact it is possible that the people can actually reach orgasm. And with artificial aids, 100% women can be taken to, in fact, orgasm. This is what actually the science talks about it now.
Any more questions, sir?
I think no more questions. We can finish with the vote of thanks. Apurva?
In fact, we take some classes on what you call as understanding men and women. What are
Sure, sure, sir. Actually, it seems really like, because it all depends upon how we think, how we feel, and everything. Many questions are coming in mind. I'm not able to put in this session because everybody come and say about their husbands when they have vaginitis. Their husbands are having a lot of feelings. They come upon and they quarrel because they are not able to participate. Many questions are coming in mind, but this is all how we can solve and all. So any.
In fact, I'm somehow understanding men and women. In fact, my wife says I'm a hopeless husband. That is a different issue. I got the point. No,
all wives say that. All wives.
No husband is a woman's hero. No hero is a woman's husband. You got the point? Once we marry, we lose that particular this thing, pedestal from where we were actually operating. We are knocked off. This is one of the very common story with many of the families. Why this happens, it will be a good understanding. Related to understanding men, understanding women, it can be made into a very interesting topic also, because there are plenty of things are available to make us understand, aware of. And from a gynecological point of view, you are there and you should be able to handle many of them. In fact, what they need is a little bit of counseling and maybe a little bit of privacy you can provide, and talk to both husband and wife for even 5-10 minutes. Many of the family problems can be solved.
Yes, sir. Thank you. Thank you so much, sir.
Thank you, sir.
Yeah, vote of thanks, Apurva.
I think.
What about it? I think.
Sir, should I or should go?
Yeah.
Okay.
Sir, sir, you were saying something, sir?
You had asked me some literature and some point. I totally forgot.
Yes, sir. On menopause and sexual health.
Oh, beautiful.
Okay. Okay, sir.
In my library, I have at least about 10 books which talk about menopause and sexual health. Big
Yeah,
book.
please. I would like to have it.
The books may not be.
Definitely, sir. We will
I'll send you a lot of literature on that particular.
Okay, sir. Thank you, sir. So thanks.
Sir, if you don't mind, can you
please
post those ones in the group,
somebody
sir? The literature?
Say something.
Yes, yes, ma'am.
Oh, thank you, Shama, ma'am. Thank you.
They're asking we can post literatures in the group.
Okay. I don't mind. In fact,
okay.
One thing is I totally forgot. I was busy with my Geron last about 8-10 days. Later we had around 300 plus guests here actually in Mysore weekend. I became free only on Tuesday.
No problem, sir. You can send me. I will send it to everyone by with the
and I think she should be able to.
Yeah, no problem.
Good.
Yeah. Okay. I feel privileged to extend my vote of thanks on behalf of Sexual Medicine Committee to our Dr. Rishikesh Pai sir to be present here and give valuable encouragement and suggestions to the committee. Thanks to Asha Bakshi ma'am to give her presence and bless the session with her valuable words and wishes. My heartfelt thanks to our chief guest, Dr. Suchitra ma'am, to give her mesmerizing presence and give her encouraging words. Guest of honor, Dr. Nirja Batla and Dr. Basap Mukherjee sir to give their support and wishes. Thanks to our faculty, Dr. T.S.S. Rao sir, for the elaborative explanation on much unspoken subject, hypersexuality, and it is really eye-opener session, and also it untied many confusions. And thanks to our own Dr. Neeraj Jadhav sir to bring upon such interesting and majorly deep-seated topics to discuss and understand many aspects of sexual health and help us to practice on these topics. And thanks to my co-moderator, lastly but not least, thanks to all delegates to join and make this session successful. Thank you.
And thanks to our ICOG chairperson. Yeah.
To give to grant us one ICOG.
Yeah.
Thank you.
Thank you all the delegate also who joined. Otherwise,
Thank you, sir.